Originally, I worked for an architect and engineering firm doing accounting. In my personal life, I experienced being a teen mom. We didn't even know that I was pregnant. We were going in to have me seen first by the doctor and to get on pills. And then we found out not only am I pregnant, but I'm 26 weeks and ready to deliver. This was a shock to me and my mother. We were on Medicaid at the time. My mother thought that we were done because they were providing me with medicine that was supposed to stop labor. She went home for the evening, and lo and behold, first thing in the morning before she got back, I had already delivered my 1 pound 9 ounce baby girl. I would have to go to the NICU daily, sometimes twice a day, or just spending the whole day there. Even though she had her nurses, it was my responsibility as her mother to be there for her, to feed her, to clothe her, to learn all the medical equipment that was attached to her, and then starting to know the people around, not just the medical people, but the actual moms and families that were experiencing the same thing that I was. After spending a lot of time in the NICU and going on to my own life, social workers began to call me to mentor other moms. Their babies were hooked up to monitors. Their babies were sick. Their babies were on life or death situations. And they just wanted someone that they can talk to that had already overcome that situation. My husband and I began to talk about the calls that I was receiving to mentor moms. And he said that there's a need there and that maybe we should open up some type of service.
I was in search of preemie clothing, particularly for twins, and we were calling around, my case managers and I, and spoke with a social worker at a local hospital who put me in touch with, she said, we have someone who comes here and does classes to moms whose babies are in the NICU, and she may have some resources. And she introduced me to Theresa. We first started out with her including our members in some of the classes that she had for NICU, at the same time working within the company that I work for to help her to become one of our community partners.
Because I was providing the service to the moms, the service began to grow. And I chose the nonprofit sector because the Medicaid population was the underserved population.
I was working for a Medicaid managed care company in Philadelphia, and I was in charge of the high-risk maternity program. We took care of about 50% of the births in Philadelphia. A lot of it had to do with some of the social factors. And I felt if we could do something about what was happening with the women before they were born and help them get through some of the issues that they were dealing with personally, then that would be a really big factor. And met Theresa, learned what the doulas were doing.
We had to educate them on childbirth education, breastfeeding techniques, what to do to carry successfully full term. We visit them twice a week.
Very early in starting my job, I was told by someone else who works in the field, you got to talk to Theresa Petaway. I reached out to Theresa. We had coffee. We talked about the work of really addressing those social and environmental determinants of health.
Because of our collaboration with the Medicaid insurance providers, we're able to actually serve our moms starting at 15 weeks throughout their whole pregnancy, to decrease their chances of delivering early.
They were actually changing the way the women thought about their pregnancy, about having children, about themselves, which was a really big difference in the way a lot of other prenatal programs were working. So we decided to start and bring the doulas into the health plan to work with initially our high-risk prenatal members, and then eventually with all our prenatal members.
I'm very excited that we're now opening up our new location downtown in Lansdowne. So not only are we serving our moms in their homes, they can come see us. They can have breastfeeding workshops, experience newborn care classes, and even have mommies mentoring mommies group.